So are we good to go, Sarah?
Through you, Mr. Chair, I can confirm that a quorum of members is present and that I believe we are ready to proceed with the meeting at your convenience.
Thank you very much. Good morning, everyone. It is 9:01, and we'll call this Grey County Long-Term Care Committee of Management meeting to order. Just remind the elected officials of your obligation to declare an interest. Not seeing any. If anything should arise, you may declare it at that time. We have no delegations this morning, Jen. The first item for direction and discussion is the Long-Term Care Committee of Management 15-24, the Long-Term Care Director's update for July 1st to August 31st. Can I have a mover to get that on the floor, please? Moved by Tom and seconded by Sue. And Jen, we'll turn it over to you. Good morning.
Great, thank you. Good morning, committee. So this update is covering the period of July 1st to August 31st. And just to highlight some ministry updates and some of the work that we're doing around training and a special announcement about our nurse practitioner role. So I will just get right into it. Lots of ministry updates. In July, the Ministry of Long-Term Care released an updated version of the entrance conference checklist for proactive compliance inspections. And so this is a checklist that when the ministry inspectors walk in the door, they say, hello, we're here. We find them a space and we get this checklist out and must work quickly to get all of that information ready for them. Where possible, we have all of that information already in a binder ready to go, but some of it needs to be printed and updated that day that they're there. But it's an updated version of that checklist. It's pretty lengthy if you click on the link and have a look at it. They also released in July communication around the PSW registration. So the legislation, the act around voluntary registration for PSWs. They are intending to consult on proposed amendments to the regulation this fall winter to align their staffing qualifications with registration pathways for PSW under this act. In the interim, current PSW qualification requirements in Section 52 of the Act will continue to apply. And our association Advantage Ontario provided an overview of the Act and regulations as a reference for members, and both are linked in the report. It is voluntary for PSWs and for operators to require their staff to register, and we're sticking with that at this stage, leaving it as a voluntary thing while it gets more established. In August, the ministry released a memo around the RIE MDS assessment instrument and continuing care reporting system tools. And so this is going to be replaced by the InterRIE long-term care facilities assessment instrument and the integrated InterRIE reporting system by April 1st, 2026. All three homes will be working with the Assessment Transition Implementation Committee in 2025 to ensure a successful launch. The ministry has put a call out for early adopters, and we've reviewed the information, but it's really quite limited and doesn't give us a lot of information on what's all involved in the rollout of this. And they're really looking for 50 operators who are keen to get going at it, but maybe be guinea pigs in the process and try to iron out some of the wrinkles. In the meantime, we are still actively working with the clinical pathways with RNAO. Dana will touch on that, or has spoken to that in past meetings. And the RNAO is working for their clinical pathways to link with the InterRIE system, and that work is still happening and hasn't been fully established. So at this stage, we're going to wait and not put our names forward as early adopters, and let some organizations that are maybe more further ahead in their clinical pathways and maybe more prepared to take on this big change. So it is coming. It's something that we're keeping an eye on. We definitely have to make that change starting in 2025 for a 2026 implementation. So stay tuned. When we know more, we will share more. The ministry also sent out a memo in August reminding operators about the responsibility and the requirement to establish family councils and the important role that family councils play in representing the interests of families and residents. We did share it with our family council members as was required. I think we can be quite proud of the work that our teams have done in supporting family councils in all 3 of our homes. And I'm going to speak to it a little bit later in this report. Our investment in building transparent and trusting relationships with our families, and our family councils play a big role in that. And finally, at the end of August, the ministry released a memo regarding Comprehensive Minor Capital Fund. And this is the fund that bundled the 3 smaller funding streams together. So it was Falls, IPAC, and Minor Capital, and they've all been bundled into one funding stream called Comprehensive Minor Capital. And so the memo is linked there. For a financial update, finance staff, in partnership with our leadership in the long-term care homes, have reviewed spending as of June 30th and prepared a projection based on trends versus budget. As of June 30th, the allocated funds are deemed sufficient to effectively operate the homes both operationally and capitally, and our capital work. The impact of in-year funding increases will be reviewed at a future committee meeting. And so that's our projection for the end of June 30th. Things are looking really good. Marcus and his team is meeting regularly with the executive directors and their teams. They meet monthly. They look at variances, make plans and strategies, and have done the work to do the projections, and things are looking really good. We continue to work with finance. So that's what this paragraph says. So we're working closely, always looking for opportunities to mitigate costs and to ensure safe environment for our residents and staff. Family updates. This fall, Grey County Long-Term Care has partnered with Bruce County Long-Term Care, and we're hosting 4 family education sessions to provide valuable insight on important topics. The important topic is the power of attorney of rights and responsibilities, as well as long-term care home rights and responsibilities. Our guest speaker is Angela Jensen. She's a staff lawyer with the Grey Bruce Community Legal Clinic and is going to lead the discussions. Angela is also a social worker and was a social worker for us in Grey County Long-Term Care a number of years ago. And then she went back to school and has become a lawyer. She did an education session for leaders in long-term care, and it was excellent. She talked about a number of different scenarios that we face on a regular basis where we are in conflict or have faced challenging situations, with situations that come up where perhaps family members are at odds with each other, or there's a disagreement between the way the home is suggesting we proceed and the expectations of the power of attorney. And she broke down for us what's our responsibility and what are our options as long-term care operators, and what are the responsibilities of the power of attorney and what are their options, and how do we find some middle ground and come to some resolution. And so she's offering a very similar session for family members who are family and friends who are the power of attorney for residents. So we are hosting 2 in Grey County, and 2 are going to be hosted in Bruce County. And the link is out there in the world and people are registering, and so it's good news. In other family information, the 2024 annual resident and family experience surveys are being released at the end of September. And this is an annual survey that we do every year. We've been using this survey for enough years that we are building a good base of foundation of information so that we can really look over time to see improvements, either opportunities to improve or areas where improvement has happened. And so we really appreciate everyone taking the time to fill out that survey. It gives us really valuable information to move forward. In the world of infection prevention and control, this still continues to be a topic that we receive lots of information and direction and pay a lot of attention to. So there was information released around vaccine administration in mid-July. We are continuing to work to identify and engage hand hygiene champions to promote best practice. Hand washing still is the best defense. So not only is it an IPAC standard of the program, but champions also conduct audits to monitor hand hygiene compliance and help to kind of remind everyone that hand hygiene is the best defense. Taylor Wallace is a recreationist from Grey Gables, and she shared her role as a hand hygiene champion and how she integrated IPAC in a fun and interactive way with residents. And we wanted to just give a little shout out to Taylor. Each month, our homes include IPAC education in the monthly newsletter, as well as emailing the tips to our designated care partners. The September IPAC tip was included in the September edition of the newsletter, and there's a link here too if you'd like to check it out. We are also preparing for our annual influenza and COVID vaccine clinics that will be scheduled for the fall, and whether the date is here, the weather certainly is, so fall seems to be here. Staff training, we continue to recruit for registered nurses, RPNs, personal support workers, food service workers. With the support of our PrEP LTC student placement coordinator, Stephanie, and the leadership teams, we continue to work with new student placement opportunities with our colleges that are in our local and surrounding areas. We always have lots of students, and it's great to see. And this is very exciting. In August, the team welcomed Leah Cantlin to her new role as nurse practitioner. Leah will be supporting Lee Manor and Grey Gables. Lee Manor also welcomed Jillian Elms as a contracted nurse practitioner. So the two homes are utilizing the ministry's hiring more nurse practitioners for long-term care homes funding policy. And with this additional support, we're happy to announce that Dr. Van Ziel will continue to support Lee Manor as the medical director, which is really great news. So Dr. Van Ziel tried to retire. It was easier to say than do. And we're really grateful that he stuck around with us as we worked to find solutions to make sure that we have enough physician coverage, physician or nurse practitioner coverage, and a couple of other physicians in the Owen Sound area have agreed to take a lead role as an attending physician. So with those physicians and with with Jillian as a nurse practitioner, they're better able to spread the work, and Dr. Van Ziel has opted to stay on as medical director. So good news. In the fall, we are pleased to announce the return of a guest speaker, Deborah Bakhti, who will present education related to the relational approach. At our November Leadership Professional Development Day, so our Leadership Education Day last fall, she presented a session. She was a keynote speaker and talked about the importance of building positive relationships with families. And this is a continuation of that. This program is designed to train internal leads who will become the relational approach influencers to confidently share their key learnings of the methodology that she teaches. And she has written 3 books, and the program takes insights from those 3 books that she's written. And really, one of the big key things is about bridging the knowledge gap. So lots of assumptions are made on both sides. So when someone moves into long-term care, it's often their first experience as a family member and as a resident. And when we are welcoming someone as staff, we forget it's their first experience, and we don't know anything about them, and they don't know anything about us. And there's some really simple strategies to help bridge that gap and start things off on the right foot. That's just one of the strategies that she talks about. So really excited about that work. And we will be having this year's Fall Education Day on October 17th. And it's always at Sydenham campus, which is a great venue for us, for all of our leaders. And that day we are planning to focus on our quality program and actions that have been identified by our Accreditation Canada survey results. The 3rd quarter of our wellness newsletter was released, and as always, it highlights Color It photos, staff appreciation, Color It stories, our CLRI, which is our Center for Learning, Research and Innovation in Aging, diversity and inclusion calendars, which is a new feature of the wellness calendar. And so we're always trying to build in new information that is useful and valuable for our team members. Partnerships, we continue to be involved in lots of different things. The regional liaison for PrEP LTC. So PrEP LTC is that program that we have funding for to train, provide training for our own staff who wish to be preceptors, so for students. And in our language, we call them Color It coaches. So the regional liaison for that program from CLRI and RIA recently reviewed our progress report, which we shared to committee in our previous report. And they reached out to Grey County to discuss further promotional opportunities. So they want to share it. They want to share our progress report with the world. Stephanie and the team did a great job putting it together, highlighting how valuable it is and the benefits of the program and people's experience. So they are promoting our approach to this program through the PrEP LTC communication team is featuring it on a blog post and on a website where people can download, other organizations can download it. They're creating schedules and social media posts promoting it. They're featuring it in one of their monthly CLRI newsletters, which goes across all of Ontario. And they're hosting a webinar featuring our Grey County representative, which is Stephanie, and for us to share our experiences. And they've asked if we would partner with them to make a submission to present at the Advantage Ontario Annual Conference in the spring. So pretty exciting. Another example of Grey County kind of taking the reins and taking a program and adding a Grey County approach, and then lots of people want to hear about it. So that's pretty exciting. In the fall, we are planning to attend high schools, local high schools, to raise awareness for employment opportunities and highlight the importance of the roles. As part of our planning, our PrEP LTC student coordinator was invited to attend a Career Navigator project brainstorming session hosted by the Ontario Association of Adult and Continuing Education School Boards Administrators. So CESPA currently offers many educational opportunities, including the PSW program, within a number of school boards in Ontario. So this was a really great opportunity for Stephanie to gain insight on the program, identify challenges and strategy development, along with creating an action plan. And also, not surprisingly, our clinical specialist, Dena, was invited to speak to the Cohort 7 group for the RNAO clinical pathways on September 11th. Oh, that's tomorrow. That's tomorrow, Dana. And so this is a great opportunity for Grey County to share our experiences, lessons learned. And so we're really proud of Stephanie and Dana for being invited to share our success and some of our challenges and some of our lessons learned. And that is the report. Thank you. There was a lot more in there than I remembered when I reviewed it.
Thanks, Jen. Certainly a lot. There's no moss growing in long-term care, that's for sure.
No.
Any questions from committee members? Warden Millen, go ahead, please.
Thank you, Mr. Chair. And yeah, Jennifer, there is a tremendous amount of stuff there and a lot of really good stuff going on in LTC, which is great to hear. But I can't help being a little bit cynical on the first item, that conference checklist thing. I see one of the items is schedule of meal times. Can you please maybe help me a little bit figure out what are they, the ministry, the inspectors, what are they trying to root out? What is the purpose of this? Or are we starting to confuse activity with actually doing stuff? Not us, but the ministry, I mean. Yeah, please.
Well, I'll see if one of the EDs wants to jump in, but there is legislation that regulates how late or early a mealtime can be. So, for example, supper can't be earlier than 5, I think, is what the legislation. It's been a while since I read that. I see them nodding. So they won't be wanting to double check that we are not trying to. We're not. That we are compliant with the legislation as it's written. So, Tolleen, if that's through you, Mr. Chair, if Tolleen can add.
No, absolutely. Go ahead, Tolleen.
Sorry, through you, Mr. Chair. So I think part of the purpose of that is it gives the inspectors what the structure is in the home, so that part of what they have to inspect is the organization of the meal service. So they need to know when to go to the dining rooms as well, that kind of thing. So that's part of it. And absolutely, it is all about, are we meeting all of the requirements under the Act related to nutritional programs? So, and there is some structure around that for sure.
Any follow-up, Mr. Warden?
Well, just to say thank you very much for that response. And I was just using the schedule of meal times as an example of some of the more obscure things that maybe the ministry should know anyway, but they want to ask, and it just, all right, that's good. Thank you very much.
Well, I was pleased that there was only 28 sections on theirs, and when we went through accreditation, there was what, 659. So it's
well, I guess
certainly
if I
reduced.
could, if I could, Mr. Chair, I'll just say that I thought, and maybe others thought the same thing, that maybe doing the accreditation process might eliminate the need for some of these more routine things that the ministry seems to want. But I recognize that I'm beating on a closed door. So from the ministry's perspective, I truly appreciate all of our staff's efforts to comply with all this stuff. So anyway, thank you.
Absolutely. Jen, did I see your hand?
Sure, through you, Mr. Chair. Doing accreditation does make meeting all of these criteria a little easier. So it does mean we have the processes in place, we have the policies, it's easier to pull that information. But the stat that I've heard, or the story that I've heard, which I still think rings true, is that long-term care is the most regulated industry next to nuclear and mining. So
I believe it.
Yeah.
Thank you.
Other questions from committee members? Jen, I had I had a couple of questions. The first one, the training session that's being done for or the family education sessions, would those be beneficial for committee members to attend?
Thank you. Great question. Yeah, I think it's beneficial for anyone who may have said yeah, sure, I'll be your power of attorney to anyone in their lives. It'll be beneficial. We are asked to do these things, and we love the person, and so we say, yeah, we can help you out, but we often don't actually know what that means until the day it's evoked, and then suddenly it's quite overwhelming. So I think they would be useful in that respect. And then as committee members, I think it would be helpful to hear the different scenarios that Angela goes through as examples, and working them through from beginning to end. And she gives examples that she's supported organizations with or individuals with. So it would give you a little more context, I think, to some of the complaints that we might bring forward that we are working through, or some of the challenging situations that we find ourselves working through.
So Jennifer, if a committee member wanted to attend, is there a sign up? Did you mention there's a sign up?
There is, and I'll after the meeting, I'll circulate the link.
All right, thank you. And my only other question, when you talk, it was great news around the nurse practitioners, but Rockwood Terrace doesn't have access to one. Is that in the plans, or did I miss something in the past? Can you just update us on that?
Sure. You didn't miss anything. So we have funding. Each of the homes have access to the funding, and the funding on its own isn't quite enough to support a full-time NP. And so that's part of it. The other part of it is just recruitment. So we've been recruiting for over a year, and it's taken that amount of time to be able to recruit and onboard Leah and Jillian. In many ways, the funding provides some flexibility. So, for example, Jillian is onboarded as a nurse practitioner, a contracted service provider 1 day a week, and the funding allows to support that. And Leah has onboarded as a staff member, able to use that same funding, doing similar but slightly different role. And so that gave us the opportunity to offer her a full-time role using funds from Grey Gables and Lee Manor. So she will split her time and support that work. And we'll continue to recruit in the Durham area for Rockwood.
Thank you.
Leah is a staff member of Grey County, and so we'll be able to access her knowledge and expertise to support and benefit programs that impact all 3 homes. But she'll split her time between Grey Gables and Lee Manor.
Okay, thank you, Jen. All right, one last chance. Any other questions for Jen's report? Not seeing any. All in favor? That is carried. Thank you. Next report is the long-term care operational report dated June 15th, 2024 to August 14th, 2024. And the recommendation is that it be received for information. Can I have a mover to get that on the floor, please? Moved by Dane and seconded by Shirley. And we will turn that over to Dana first. Morning,
I'm going to
Dana.
start.
Pardon?
I'm going to start.
Jen?
I'm going to start. Yep.
Okay.
Thank you. Thanks, Mr. Chair. So our operation report, I am kicking it off because I'm going to speak to the quality section. And so since our last meeting, Renata has retired, and we wish her all the best in her retirement. And that has left us in a circumstance where we've been working to determine what does our quality program look like? How are we handling our quality program moving forward? And so what you see here is not new news. This is the same chart with the same information that was in last last meeting's report, and so there's nothing really new to say in terms of the chart. But what I can say is around how we're addressing quality moving forward is that the executive directors, Dana, and so clinical specialist, and I have had some a couple of strategy days looking at our quality program and setting some vision for the future, looking at with a focus on alignment across the 3 homes, focused on our indicators and audits, how are we using the data, what are some opportunities with the data, how are we managing it day to day, month to month, quarter to quarter, and then over the year. And so we've done some significant updates in our policy, and that's the stage that we're at now. So we're getting those policies updated. We're kind of doing a soft launch, making alignment, making the changes in the last quarter of 2024 with the plan for all of the updates, all of the alignment in terms of our quality meeting structure, that we're using similar indicators across all 3 homes. What are programs that are available to support us with data analysis? That all of that is in place for January kickoff. And so the 5 of us are committed to holding up our quality program and keeping in mind and rolling in accreditation, because now we start again of the first year of our next 4 years of our work for Accreditation Canada. So rolling that in and feeling like we're in a really good place to move forward with our quality program. And so that's the story so far. So we just held those strategy meetings the end of August, and are feeling like we have a good handle on things and are looking forward to giving you some updates as we roll it out. And now we can kick it over to Dana, unless you have a question.
Jen, that's great that, hopefully, we're striving to get some consistency across our 3 homes. Any sense that the province may try to do that across the whole long-term care sector?
Well, really the legislation is standard. It's how people interpret the legislation and regulations. Every organization is required to have a quality program. The province doesn't dictate specifically what that quality program looks like. And without intentional active work, it's not hard for 3 organizations in the 3 homes in the same organization to start to, become a little bit different over years. And so really we're just bringing that back with a focused intention on having a consistent approach across the 3 homes. And the program that I spoke about at the beginning of the director's update, the Inter-RAI and CIHI, so the RAI data and the CIHI, tell me, what does CIHI stand for?
Sorry, Canadian Institute for Health Information.
Yep, thanks. Those programs also provide the overarching standard for all long-term care homes. So it's more about the how than the what you need to achieve. So we're focusing on consistency on the how we're going to get there.
Thank you. All right, we'll go to Dana now. Morning, Dana.
Good morning. And through you, Mr. Chair, I want to give an update, a clinical update, and in particular, an update on a funding program from the Ministry of Long-Term Care. And it's a new acronym to add to our repertoire, the ITS, the Integrated Technology Solution. And this program essentially is replacing 2 former programs I've shared with committee, Medication Safety Technology and Clinical Decision Support Tool. So they've essentially merged the 2 and given us some new direction But essentially, the intent of the funding is to further use technology to support quality services. And again, as we've been talking about consistency, etc. So I think it's a good place that we're in. The funding has been effective since April 1st, 2024, this new funding, and it goes until March 31st, 2026, with the amount that we receive proportional to the size of the home. So I did put in the report the funding example to give you an idea of what each home will be receiving based on the number of residents who live in each home. So just to give you a high-level summary of the two projects that are being supported by the funding. First, we have introduced a new infection prevention and control module, which is embedded in our electronic medical record, Point-Click Care. And so previously we were tracking infections in a more manual way, albeit we definitely had a structured approach. We've used Excel spreadsheet, but essentially there was a significant effort to collect and analyze this data. And with the new module that is going to be effectively rolled out at the end of the month, it will show real-time surveillance data with an interactive dashboard. It'll increase awareness and understanding of infection cases because it's right in our EMR. There's actually a bit of a stop sign. So even from our PSWs to anyone interacting with our electronic medical records, they'll recognize that there's a potential infection. It can lead to early identification because it will trigger in the system when there's symptoms of an infection. It also helps to communicate to all team members the additional precautions we put into place, and it'll also PPE. So obviously we certainly want our staff, and we're educating and training about infection prevention and control as an ongoing standard, but it's there in case people want some clarity. It's fairly straightforward. It can also identify trends in infection data and early triggers for potential outbreaks and meets ministry requirements for data reporting. So when that inspector comes in and requests, I forget which number it is on that checklist, but we can pull a report very quickly, identifying which resident has an infection, which area, and what are the details of that. So that's something we're looking forward to, and it's quite supportive. The module, as I mentioned, should be ready to go at the end of the month and help us to get ready for our upcoming fall respiratory season. However, we know COVID has no season, and I hear that there is influenza already in the south of us at the moment. So as we're flagging that, but along with this module, our team this week is getting prepared by attending a session that Public Health is hosting, where we hope to hear about when we can access our influenza vaccine and the new COVID vaccine. So stay tuned on that. The other integrated technology solution we have implemented is called Secure Conversations. Now, Lee Manor was an early adopter of the Secure Conversation with one physician a while ago, and found the program to be beneficial, and they plan on expanding it to the nurse practitioners that we just heard about, as well as a few more attending physicians. And over the summer, Greg Gables and Rockwood Terrace have added this tool to their home as well. And just to give you a little bit more about Secure Conversation, it's a text messaging application that allows team members to send protected, encrypted messages from their smartphone or PCC to the healthcare provider. That encryption obviously helps us to be compliant with privacy legislation, but it also supports us with time-sensitive messaging. It could be lab results, it could be a resident-specific question, or any other important personal health information we need to share back and forth. So it's confidential, and from the staffing point of view, they're thrilled. It reduces that phone tag. You know, when you send a message off to the physician, can you give us a call? This way we can share securely what we need from the physician. We can see that it's been delivered. We can also see that the physician has read the message. It helps with accurate decision making because we're able to provide a bit more detail in those text messages. Obviously, some data to help them make decision making, improved resident outcomes because it's quicker. The physicians are quite pleased with it. The feedback is great. And there's also a photo imaging sharing option with messages. You know, a picture can say 1,000 words or worth 1,000 words. And then it stores these text conversations in the resident record as progress notes. So having this funding and implementing it successfully has been a great summer project. No moss at all. We've been rolling, and it continues on in the next year. And we have some great plans in the works that the team's excited about, and having some new technology to support us with skin and wound care. So stay tuned for that. I'll be excited to share that next clinical update.
Thanks very much, Dana. Exciting news. Any questions to Dana from any committee members? Sue, go ahead.
Thank you, Chair Scott. Dana, so if you don't have a smartphone, you use the electronic health record platform? Is that?
So, yes, great question. So with the MSTP funding that we previously had, we purchased all physicians smartphones. We also purchased additional tablets to get us in that state of readiness, as well as have the application on every phone. So they'll have the PCC on their phone. So registered staff, if they're on the computer, there's a little icon for secure conversation, right? All staff have the access to the desktop or their laptop or the iPad. They can send the secure messaging to the physician who has, and our physicians have iPads, our nurse practitioners have the secure app on their phone as well. So we've been able to support with this technology. They'll get alerts. And then the rest of the care team know from a communication point of view, they can see the message. So if the new upon shift change, for example, they can see that message because they're in that grouping. And so it's a secure conversation. If it's completed, it'll be in the progress note and recorded. Does that help to explain that process? Okay, thank you.
Thank you.
Shirley, go ahead.
Thanks very much, Mr. Chair. Just curious to know, Dana, just coming back, of course, from AMO, when there was a session there on AI, and just wondering if, as you mentioned, new technology, if there's any consideration or exploration happening in long-term care with the thought of all the report writing that has to happen for all of the, first of all the compliance requirements with the province, and as well as all the patient records, whether there's any early discussion happening on the use of AI in that type of use.
Through you, Mr. Chair, I can speak sort of more clinically about AI. That skin and wound technology that I described is indeed an element of AI, and I think we can just build on it in terms of being able to take a camera and put it on the wound. It will help support us with depths of wound, even make some recommendation in terms of product, etc., and making some of that aligning. In terms of report writing, I think that there is opportunity, but I don't know enough about that. I do know we have to be cautious with AI with certain reports because depending upon the platform that you're using, privacy is not assured. What we do know that's assured is in our platform, the PCC platform with the encryption. If we utilize modules that are aligning with that, the PCC IPAC module in terms of writing reports, that is secure, and that is essentially working on some trending and reporting. The other part to that too is that we have an ability to look at corporate reporting, so we can do corporate reports and generate it through, for example, the PCC, where we would have had to do that more manually across the way. But I think, Councillor Keaveney, it's a work in progress, and we are on it, but there's a lot to learn. So we are looking forward to it, and it looks like Jen can add a little bit more on that.
Anything else, Shirley?
No, that's great. Thank you very much, Mr. Chair.
Jennifer.
Thanks, and thanks, Dana, for covering the clinical piece. Perhaps not, it might not be all AI, but technology focused. A handful of us, a couple of us, I'm not sure how many of us, but are headed to Trinity Village next week or the week after, which is a long-term care home in Advantage Ontario's Region 3, which we're part of. And Trinity Village has implemented quite a lot of technology. They had come to one of our virtual meetings and talked about all of the different technology things that they've implemented, from robots that greet people at the front door to smart toilets, all sorts of really interesting things. And so Region 3 has organized a road trip to Trinity Village, and they're going to give us a tour of all of their technology and how they're using it. So that will be really interesting, and we'll be able to share back what we learned there.
Thanks, Jen. I'm not going to ask what a smart toilet is, so we'll move
Yeah,
on to
good idea.
Karen.
Save it for the next meeting, because I can't. Yeah.
All right. Thanks very much, Dana. Not seeing any other questions for Dana. We'll move to Karen. Morning, Karen.
Good morning. Thank you, Mr. Chair. Just wanted to provide a little update on the recent visit from the Ministry of Long-Term Care to the Manor in July. I believe a verbal update was provided at the last meeting. There were no findings as a result of that visit, but the formal report is linked there in our report for your reference. Also, just wanted to highlight, we've talked frequently about the incidents we need to report to the ministry through a critical incident system report. One new one that we don't see very often, and I just wanted to talk about today, is misuse or misappropriation of residents' money. This could present itself in a couple different ways. It could be that the home or the licensee has identified that we believe there might be potential financial abuse towards a resident, in which case we are obligated to report to the ministry. In this particular case, there was an allegation from the resident himself to his POA. So again, we are required to report and to help support the resident to address that situation. So it might be social work visits, it might be support to look at a different power of attorney, those kinds of things. So just another example of a critical incident that we are required to report, even though we had no hand in it, if I might say it that way. Another situation where there might be reporting regarding funding is if someone believes that the licensee or the home is misusing government funding provided to the home. So an example, we haven't seen any, I don't think, during my time in long-term care, but example could be if someone believes we are using, say, raw food money for something other than what it was attended, and they can call the ministry and report the home related to something like that. So just wanted to highlight those areas, something we don't talk about very often, but is definitely out there.
Thanks very much, Karen. Any questions for Karen? Karen, we talked a little bit, I think, through accreditation, but some of these areas, can we get a little more detail? You know, abuse and neglect, improper treatment and care. Can we get a little more, like some we always know are just allegations and are unfounded? Can we get a little more depth on some of the ones that maybe have some basis to them?
So I looked to Jennifer about that, because that may mean closed session, but I'll let Jennifer.
Yeah, through you, Mr. Chair. I think if committee is interested in that, those situations, because of the numbers 7, 1, 5, those are quite small numbers. To talk about those situations, well, and of those 7, 5 may have been unfounded, 2 may have been some version of being an accurate accusation, and then how did we handle that? What was the outcome? May resulted in discipline or termination of an employee. So those are all areas that could be quite identifiable. So if it's the interest of the committee to talk about those things more in depth, then I would work with the clerk's department and look to the clerk's department for guidance on how that might look. So whether it's maybe twice a year, we plan an in-camera and talk about more of those things. And I don't know if clerk or Tara or Sarah or Kim, if you have suggestions on handling that.
Well, maybe Jen, I'll just maybe look to the other committee members to see if there is any interest in, as you mentioned, a couple of times a year, going in camera for a little bit more information on ones that, may have some basis. Committee members, what are your thoughts? Warden, go ahead, please.
Thank you, Mr. Chair. I guess when I looked at that chart as well, and Jen mentioned that those, 7 and 5, those numbers are quite small. Even 1, it kind of catches your attention. You wonder, well, what's going on. So I'm not so much interested in the actual details of the incident or alleged incident, but again, if the incidents could be put in context into all the good things that are going on in the homes, some more context as to is this a small number, is it a large number, were they founded, were they not founded, that kind of stuff, and how it's dealt with, or is it being dealt with to be more important. At least for me, I'm not interested necessarily in the actual details of each incident. It's just, are these anyway? I guess I said what I thought. Thank you.
Tara?
Thank you, Mr. Chair. What we have talked about doing in the past, and we could look to do at maybe an upcoming meeting, is have kind of an education training session for a committee around exactly that, kind of the process of how some of these things are handled in a general sense. And then that will give you kind of an idea of what staff are working through and what steps they're taking to address some of those things that come up. So we can work with long-term care and see what we can do in the future.
Okay, thank you. Kim, good morning.
You're on mute,
Kim.
I try and click, but here we are. Okay. In addition to the comment that Tara just made, well, there may be, or I know that there is actually some consistency of process. What's happening in each one of those situations is quite specific. And I know I certainly would be supportive of, periodically giving this committee just some of those details, just so you kind of get a little more detailed frame of reference around what the staff are actually dealing with on a day-to-day basis, and where we're seeing some challenges and what we're doing about them. So I think both things are possible. One is to just ensure that everyone's very familiar with the process that's used when there is an incident, and then periodically we can talk to you about some of the specifics that have happened and how those were dealt with and what the implications were for the county and others.
I think that would be great, Kim, and I think you framed that very well. And we just see the numbers, and as the warden indicated, we don't know how many of those are actually reflective of any misdoings by us, or just someone that's complaining. So I don't think any of us want to know any names or any of those details at all, but just to know how the processes are going, and that would be great. So we'll leave it with you. Thank you.
Mr. Chair.
Yeah, sorry, go ahead, Jen.
Sorry, I appreciate leaving it there, and I will take that back. I do just want to leave in the meantime you with another perspective. If those numbers were all 0, particularly, alleged abuse or neglect, improper, incompetent treatment of care, those two specifically, if they were always 0, I would be more concerned. So while we don't want to have high numbers of alleged allegations, we also don't want to have 0, because we know humans are working with humans, and often there can be conflict or misunderstandings. Often the allegations are unfounded, but an opportunity for education on both sides sometimes. So it's like grievances or complaints. If it's 0, the worry is that those things are still happening. We just don't know about it. So it is a balance. And I try to keep that in mind. And as a team, we try to keep that in mind, that it is a balance. And so I'll leave it there, and we'll work on how we can give the information that's useful, and we'll go from there.
Thanks, Jen. Well, you've got a lot of sponges on the committee, so we're always looking for information. So thank you. Was there any other questions for Karen? All right, we'll continue on to Shannon.
Perfect.
Morning,
Good morning.
Shannon.
Good morning. Through you, Mr. Chair, I'm going to report on the outbreaks in the people section. Outbreaks have become a more common reality for us in long-term care. As we all have experienced them lately, all of our outbreaks have been well managed with the utmost care and diligence. Our dedicated staff have implemented comprehensive safety protocols to protect our residents and team members by responding swiftly and effectively to each outbreak. Communication has remained our priority. We know how important it is to our families and our partners to stay informed, so we consistently provide updates, which have been greatly appreciated by all. Under the people, I'm pleased to share that our hiring trends have been incredibly positive recently, thanks to the intentional and focused efforts of our HR partners. Their dedication to finding the right people who are passionate and providing exceptional care have been invaluable. I would also like to highlight the increase in student placements, which brings a fresh perspective and energy to our homes. We deeply appreciate all the hard work put into fostering these opportunities for growth and collaboration. So thank you.
Thanks very much, Shannon. Any questions for Shannon? No, it's great the work that HR and the homes have done in recruitment. Nice to see that those positive increases.
For sure.
Okay, I think not seeing any questions for Shannon, so we'll take it, hand it over to Tolene. Good morning, Tolene.
Good morning, through you, Mr. Chair. I've been asked to talk about our report this morning on the events that are happening in the home and the color it stories and that kind of thing. So I was actually kind of inspired to talk about my approach for this morning. I was inspired by the photos at the start of the report. So if you remember, there's a photo, for example, of one of our residents with the pony and how joyful he looks in that image. So I wanted to sort of focus about that feeling of joy through the events that took place over the last few months in the home. So I sort of wanted to take the approach about describing those events rather than talk about the event specifically, which you can read in the report. I kind of wanted to share why these are so important to us. You know, families and residents and staff often think about and refer to programming events as entertainment. What's going to be happening in the home this week? What's on the calendar? How are we going to be entertained this month? But it is so much more than entertainment. And so I wanted to kind of focus on that. So the program events that we host help foster a sense of community within the home. It's about building friendships and companionships and relationships. It's often about supports and partnerships outside of the home. And it's about continuing to bring life to the lived experience within the home for our residents. So I wanted to highlight the similar focus and those intentional, thoughtful integration of nature and community into the work that we do in long-term care. So this summer, the homes had similar themes. We celebrated Father's Day in June. We had lots of food events presented in fun, energized, and connected ways. We brought animals into the home, into all of our homes in different ways. We had some dog shows, we had some pony visits in a couple of homes. I love the story that Rockwood brought with the butterflies, just a beautiful story. We brought education from the, I'm never going to say this right, but the 2 SLGBTQIA plus leaders who inspired our residents and staff. And I will say that they also expressed to the home how inspired they felt and how inspired they were from the engaging interaction with our residents and staff. We also had summer themed parties and Olympic themed entertainment. So the message that I want to share is that all of these activities support that sort of human connectedness through tactile, emotional, and memory experiences for our residents. Our recreation teams have very knowledgeable, purposeful, high-level education in gerontology and how to bring those experiences to the people that they serve. So, you know, imagine the feeling of wiggling your toes through the sand when you haven't been able to get to the beach in a really long time. Imagine the joy of having those butterflies land on your finger and watching it fly off on its journey. Imagine the thrill of running your hand through the mane of a pony or the wriggle of a dog's nose, reminding you of your childhood. Imagine the sense of purpose when you help make dinner by shucking the corn. Those are the experiences that those programs bring to our residents. So long-term care really is a place where, despite the abilities we have to face in life, we can still have fun, laugh, and live a life worth living. So I really feel that that's what that report brings to the committee. Thank you.
Thanks very much, Tolene. There is no question that animals are very therapeutic, and that's when my wife goes to the barn for her horses. Questions from any of the members? Okay. Sorry, Sue, go ahead.
Thank you, Mr. Chair. I just want to say I really appreciated the tour of Lee Manor and of course Grey Gables, but after seeing how the food was delivered to everyone, I understand it would be quite a feat to eat outside. Like it's, when you see the elevators and what the staff are doing to make it happen and how much people appreciate eating outside, that to make that happen for the residents must have been just a very huge effort from everyone. So congratulations to everyone who's helping make the residents' lives so fulfilling. Thank you.
Very well said, Sue. Any other comments? Not seeing any. All in favor of receiving the report? That is carried. There's no correspondence, Jen? Other business? Don't believe there's anything. Maybe, Jen, can you just, our next meeting is scheduled, a joint meeting with the Finance Committee. Can you just give us a brief overview of how that's going to be structured? Is that going to be in person? Or I'm hoping it would be, but go ahead, please.
Through you, Mr. Chair, and I may defer to Kim or Tara. My understanding is that meeting will be in person and we will be presenting the long-term care budget, the 2025 budget.
So the purpose of doing it in conjunction with the Finance Committee without us seeing it first, is that just to save on duplication?
I believe so. Kim, did you?
Part of it is just the timing. Certainly the information that will be presented to the Budget and Finance Committee will be at a much higher level than what this committee traditionally has a chance to really consider. So in order to keep the budget development process moving forward, we need to have at least a number, a set of numbers to go into the budget. So it's not going to be a very detailed analysis at Budget and Finance. My hope is that
this will be a good budget for the long-term care department this year, that Budget and Finance Committee is going to get a set of numbers from this department that they're comfortable with moving forward into the development of the overall county budget. But so that's a bottom line kind of perspective. Whereas this committee, I think, is wanting to and has traditionally taken a much deeper dive into what's happening with 10-year capital, where are various line items kind of moving around within long-term care, and having the opportunity to provide insight and direction back to the staff about, whether or not you have any concerns or want to see any changes. So does that help to give a bit of perspective? Yeah, it's not like Budget and Finance is not doing your job here. They just are getting a number as far as levy impact to include in the 2024 budget. And I think this year there's going to be a couple of iterations of that. So they'll see a number. You guys are going to do your work. I think there might be a second conversation after that as well.
Okay. Well, I know Mark has got a lot of information coming forward that we'll be looking forward to. So,
right.
Okay. So that is the 28th of October. So everyone get that in their agenda. So we'll be hopefully meeting in person. Is there anything else from any members or staff? If not, we'll call the meeting there. I guess I'll ask for a motion to adjourn, moved by the warden and seconded by Tom. So we stand adjourned at 10:07, and I hope everyone can enjoy the rest of their summer's week. Take care. We'll see everybody Thursday.